All right, folks, get ready for a deep dive today. We're talking glaucoma surgery.
That's right. Lasers, implants. We're going deep on how doctors are working to save your sight.
Yeah, and this is a big one for a lot of our listeners, I know. Getting into the details of surgery, it can be a little intimidating.
It's definitely a big decision, no question, but hopefully we can clear up some of the confusion around it today.
That's the goal, for sure. Now, the source material we've been diving into, it actually uses this clever comparison, talking about eye pressure like it's a plumbing problem.
That's a good analogy, actually.
Yeah.
Think of your eye like a sink. You've got the faucet, right? And that's constantly producing this fluid.
Okay, I'm with you.
That's like the aqueous humor constantly flowing, nourishing your eye. And then you've got the drain. That's your eye's drainage system. Keeps everything balanced. But when that drain gets clogged,
Uh-oh.
that's when the pressure builds up. That's your intraocular pressure, or IOP. And if it's not addressed, it can damage the optic nerve.
And that's the last thing we want, right? That's the connection to your brain, how you
Right.
see the world.
Exactly. That's where surgery comes in to fix that plumbing problem, so to speak.
And there are options, right? I mean, I'm surprised to see like 5 different types of surgery mentioned in our source material.
Yeah, and they all have their pros and cons. Which one's best for a patient really depends on a lot of factors.
Like their specific type of glaucoma, how advanced it is, things like that.
Exactly. Their overall health, too, their age. And even the surgeon's expertise comes into play. Certain surgeons might specialize in certain techniques.
Makes sense. So let's start with maybe the least intimidating option on the list, laser surgery.
Okay.
Because I got to admit, even just hearing that phrase laser surgery, it sounds kind of scary, but it's actually the most common type of glaucoma surgery, right?
It is. It's often the first line of treatment, especially for open-angle glaucoma.
Hold on. Before we go any further, can we define that? Open-angle glaucoma.
Sure. So that's when the eye's drainage system, it looks normal, but it's not working efficiently. It's like a slow drain. The fluid's still flowing out, but not fast enough to prevent that pressure buildup.
So with laser surgery, are we talking about like blasting the clog away with this laser beam?
Well, not exactly blasting, but you've got the right idea. Take SLT, for example, selective laser trabeculeplasty.
SLT. All right, got it.
It's often the go-to for open-angle glaucoma, at least initially. What it does is it uses a laser, a very precise laser, I should say, to target specific cells in the drainage angle.
The drainage angle, so like where that slow drain is.
Right. And by targeting those cells, it stimulates this natural healing process, improves the fluid outflow, which lowers the eye pressure.
That's amazing. They can do that with lasers now. So precise.
It's remarkable, isn't it? And it's often very effective. The Glaucoma Research Foundation, they report that it's effective for about 80% of patients initially.
80%, that's incredible. You said initially. Does that mean it wears off over time?
It can for some people. It might last for a few years, and then they might need additional treatments.
Okay, so it's not always a permanent solution.
Not always, no. It varies.
And who is a good candidate for this SLT?
Well, people newly diagnosed with open-angle glaucoma, often. Sometimes people who don't respond well to the glaucoma medications, or maybe they can't tolerate them.
Makes sense. Now, SLT is just one type of laser surgery, right? Our source mentioned a couple of others.
Right. You've got ALT, argon, laser trabeculeplasty. That's another one for open-angle glaucoma.
ALT, okay.
It uses a different kind of laser, targets a different part of the drainage angle. And then there's LPI, laser peripheral iridotomy.
LPI. And that one's for...
That's primarily for angle closure glaucoma.
Okay, so that's a whole other type of glaucoma then. We've got open angle and now angle closure.
Right.
What's the difference?
Well, angle closure, imagine that drain in your sink suddenly getting completely blocked. Oh, no.
Yeah, it's like a plumbing emergency. The pressure spikes rapidly. It can be very serious.
Oh, and that's where the LPI comes in.
Right. It's like creating this little bypass valve in the iris, which is the colored part of your eye.
Okay.
And that lets the fluid flow more freely, relieves the pressure.
These surgeons are doing some pretty incredible stuff. It's amazing when you think about how small the space is that they're working in.
Microsurgery, it's incredible.
But it's not always laser beams and tiny bypass valves, is it? Our source mentions some procedures that are a bit more invasive.
Right. Sometimes laser surgery alone isn't enough, especially if the glaucoma is more advanced, or maybe it doesn't respond well to the laser treatment. That's when you might be looking at something like a trabeculectomy.
Trabeculectomy. That's a mouthful.
It is. Or drainage implant surgery. Let's break those down, starting with trabeculectomy. It sounds kind of like Creating a whole new drainage channel.
Exactly. That's a great way to put it.
Going back to the sink analogy.
It's like adding a new drain to that sink. The surgeon creates this tiny flap in the white part of the eye, lets the fluid bypass that clogged drainage system, flow out more easily.
So that it's like a controlled leak, basically.
You got it. Relieves the pressure inside the eye. And then there's the drainage implant.
Which is more of a permanent solution.
Yeah, you're thinking along the right lines. That's where a tiny tube, almost like a stent, is implanted in the eye.
So it's like we're bypassing the eye's natural drainage system completely.
Pretty much. It's a way to create that constant pathway for the fluid to drain out.
I imagine for a lot of people, just hearing all of these options, it could feel pretty overwhelming.
Oh, absolutely.
How do you even begin to decide which approach is right for you?
That's where that conversation with your ophthalmologist is so important. They're going to look at your individual situation, your type of glaucoma, your overall health, and guide you towards the best option.
Because there's no one-size-fits-all approach here.
Exactly. Everyone's different.
But I'm guessing, no matter which procedure we're talking about, that first step towards the operating room can be pretty nerve-wracking.
I can only imagine.
So for our listeners who might be facing that, what can they expect on the day of surgery?
Well, you'll typically arrive at the surgical center, and the team there will walk you through everything, make you feel comfortable, answer any questions. They'll put some eye drops in, get your eye ready, and the anesthesiologist will be there to make sure you're comfortable throughout the procedure.
Because most of these are done under local anesthesia, right?
Right, so you'll be awake, but you'll be relaxed and pain-free.
That's good to know.
You might feel a little pressure, maybe some slight tugging, but it shouldn't be painful.
That's reassuring, at least.
And afterwards, they'll monitor you for a bit, make sure everything's okay, and then you can usually head home the same day.
So it's not like you're stuck in the hospital overnight.
No, not for most glaucoma surgeries.
That's good. What about recovery, though? I imagine that varies quite a bit depending on the type of surgery.
You're right, it does. For laser surgeries, the SLT or LPI we talked about, you can usually go back to most of your normal activities the next day.
Wow, that's quick.
It is.
Yeah.
But you'll want to take it easy on your eyes for a couple of weeks.
So no staring at your phone all day.
Probably best to avoid that. And no heavy lifting, that kind of thing. Just give your eyes a break to heal.
Makes sense.
Yeah.
But for those more invasive procedures, the trabeculectomy, the drainage implant, I'm guessing the recovery is a little longer.
It is. You'll probably have to wear an eye patch for a few days.
Really?
Yeah, and you'll be using medicated eye drops to prevent any infection or inflammation.
To help with healing.
Right. And it might take a few weeks, even a couple months, for your vision to fully stabilize. So it's important to be patient and follow your surgeon's instructions.
Don't try to rush it.
Exactly.
So we've covered what these surgeries are, how they work, but what about the why? The risks and benefits? Because I know our source mentioned some potential complications.
Yeah, and it's important to be upfront about those. Like any surgery, there are risks involved.
There are always risks, right? It comes with the territory.
It does. And with glaucoma surgery, those risks can include infection.
Okay, that makes sense.
Bleeding, inflammation, those are possibilities too. And there's always a chance, though it's rare, of a change in your vision.
A change meaning it could get worse?
It could. It's not common, but it's a possibility. Sometimes it's temporary, sometimes it's permanent. And then there's something called hypotony.
Hypotony, that's a new one.
That's where your eye pressure actually drops too low.
Wait, I thought we wanted the pressure to go down.
You do, but you need to find that sweet spot, right?
Goldilocks syndrome.
Exactly. Not too high, not too low. Hypotony, it can happen, especially in those first few weeks after surgery.
So you're really monitoring it closely during that time?
Absolutely. That's why those follow-up appointments are so important. We want to catch any issues early on.
Makes sense. So with all of these risks, why even consider surgery in the first place?
That's a fair question, and it's a conversation to have with your doctor for sure. But the bottom line is, for many people, the benefits outweigh the risks.
Because we're talking about saving their sight.
Exactly. Especially in advanced cases of glaucoma, or for people who aren't seeing results with medication, or maybe they can't tolerate the medication, surgery might be the best option to preserve their vision.
To maintain their quality of life.
Exactly, to keep doing the things they love without their vision holding them back.
It's a big decision, no doubt. And I know a big part of that decision for a lot of people comes down to cost. Did our source material touch on that at all?
It did. It pointed out that laser procedures tend to be the more budget-friendly option compared to the more invasive surgeries.
Which makes sense.
The laser surgeries, they're often done as outpatient procedures, so you're not dealing with a hospital stay, which can really add up.
Oh, absolutely. Hospital bills are no joke.
Hmm.
But our source also made a good point, and I wanted to reiterate it here. Cost should never be a barrier to getting the eye care you need.
I completely agree. It's so important to remember that. Most insurance plans do cover glaucoma surgery, especially when it's considered medically necessary.
Okay, that's good to know.
And a lot of surgeons, they offer payment plans or they'll work with patients to help them find financial assistance if they need it.
So there are options.
There are. The key is don't be afraid to talk about it. Talk to your doctor, talk to your insurance company, and figure out what's possible.
Be your own advocate.
Exactly. It's your health, your vision. Don't be afraid to speak up.
So for our listeners who are out there, maybe thinking, okay, after listening to all this, I'm a little concerned about my own eye health. What are some of the warning signs they should be looking out for?
Well, we can't give medical advice here,
Well, I can
obviously.
say, go for course.
But I can say this. When it comes to glaucoma, early detection is key.
So those regular eye exams, they're crucial.
They're so important, like going to the dentist. You don't wait till something hurts, right?
Exactly. You go for those regular checkups.
Exactly. Same thing with your eyes. Your ophthalmologist, they can check your eye pressure, take a look at your optic nerve, make sure everything looks healthy.
And if they spot something that's concerning,
Then they can talk to you about a treatment plan.
which might involve surgery or maybe something else entirely.
Exactly. It's all about what's right for you, for your individual situation.
So much good information in this deep dive. I guess knowledge is power, right? The more you know.
Absolutely. When you understand what glaucoma is, how it affects you, the different treatment options, you're in a much better position to make good decisions about your health.
Exactly. So don't be afraid to ask your eye doctor questions. Explore those options. Be your own advocate.
It's your vision, after all. It's worth it.
It really is. And on that note, I think we've done a pretty deep dive on glaucoma surgery for today.
We covered a lot of ground.
We did. So to our listeners, we hope you found this helpful, informative, and hopefully empowering. Knowing what's out there, understanding the options, that's the first step.
And remember, if you have concerns, talk to your doctor. They're there to help.
Couldn't have said it better myself. Thanks for joining us for this deep dive, everyone. Until next time, take care of yourselves and those precious eyes.